Welcome back. News is coming in from the Delhi High Court, which is hearing yet another case of the COVID crisis, the shortage of infrastructure and oxygen. And in hearing so, the High Court has observed states' obligation to provide sufficient infrastructure to save lives of people cannot be understated. Most economically advanced states also found their infrastructure to be lacking in dealing with this. Neelashish is joining us live. Neelashish, two questions. First, is this an observation or is this part of the order? And second, the interesting part that the counsel for the Delhi government, Rahul Mehra, asked the court to not mention the shortage of infrastructure but only of oxygen. Why?
Yes, this is very much part of the order wherein a patient had asked that orders be passed to allow a bed for a patient to be admitted in a hospital whose oxygen levels are below 40 apparently. Now, in dictating this order, the High Court has very clearly stated that the existing medical infrastructure in the state is in shambles and is completely exposed when put to test. Before that, it was noted in the order that it is the state's obligation to provide sufficient infrastructure to save lives of people, and this fact cannot be understated. Delhi Council, Rahul Mehra, tried to say that this aspect should not be said, that the entire medical infrastructure is in shambles. The problem is only of oxygen, is what he urged. But the High Court quipped and remarked that it is not about oxygen, it's more than just that. And in fact, the court went on to slam the Delhi government after that, saying that when you are trying to defend something like this, which is the system, you are not rising above politics. We as a court will always call a spade,
okay.
And we have felt that the state has failed in certain situations, and this needs to be taken up. What will we tell the family is something the court also asked. So, of course, this is something
important order. Thanks very much, Neelashish, for joining us. Taking a very quick break, more on the other side.